Good to see you, friend. Yes. Just to get here, right?
That's right. Just to start.
All the work just to get here. Yeah.
First time, day one.
Yeah, totally.
All right.
Right. I mean, I want to go. Whatever this is, I don't want to rush it.
We can also come back and do more later.
Yeah. Yeah. I don't want to rush it.
Yeah.
Mm. So, I mean, maybe it's like the question, or a question, that, I mean, one of the questions that brings us together is this thing called health, right? What is it? Like,
Why don't we start with a question before that?
yeah.
Why us? Why have you brought us? Why does it make sense for us to come together? Before we start into any questions.
Mm-hmm. Why have we come together?
Yeah.
Yeah.
Why'd you reach out? And I mean it in the us, not why did you reach out to me?
Yeah.
Right? As in
Yeah.
like, and then that gets us out of the interview.
Yeah, for sure.
Because if you reached out to me, then it's an interview. But if you go to why us,
Yeah.
then we're into discussion and dialogue.
Yeah. Well, I think back to the way you described the way the Bushman track, you know, the hunt, that there's sometimes one hunter and they can feel like a good relationship to what it is that they're hunting. And I think you said something about you're always right when it's just you, right? Because you have no other
Right. So that
thing to go off.
Yeah, it was a saying by my friend John Young. When you track alone,
Yeah.
you're always right.
Yeah.
And that's not a compliment.
No.
Yeah. That's that is in a sense that trickster mind will convince you that the story and narrative of the tracks you're reading,
Yeah.
is a correct one. So it lacks inappropriate feedback or calibration
Yeah.
or cooperation.
Mm-hmm.
It doesn't. So every exercise in tracking has to be an exercise of 2 or 3 or 4.
Mm-hmm.
And when you look in, at a reasonable size hunting group, that's sort of what you're looking at 2 to 4, 2 to 5 people. Too much. You're getting too many voices coming in at once and confusing the story. But just that right amount of tension to say, okay, what do we actually hear as reading is true? True such that we can find our prey.
Yeah. So, being together in the tracking, it's more reliable.
It is more reliable.
Yeah.
And I think more than reliable, so that's important, right? Because but let's be careful there, because that we've gone right away to a notion like reliability is kind of a practical term, right?
Yeah.
There's a pragmatic sense of, I don't want to minimize that, because at the end, we want to catch the prey and be able to bring meat back home to the village, right? So there is a greater reliability, there is a greater chance of success that venture will happen. But I think more importantly, though, is what we have to realize is that when we read the tracks together, like reading any story, we get to participate in sharing the story. And that's not about reliability, that's more about enjoyability.
Yeah.
Right? So how do we enter into the joy of that experience, right? And then the camaraderie and the companionship, and not just with each other, but with the animals that we're with and the land that we're with, right? And so yes, in the end, indeed, it is more reliable, and that's almost like the obtaining of the goal is almost the regrettable necessity, but actually the unfoldment of the story and following it and telling it. In some ways, the getting of the goal is like the end of any story, right? It's like the end of any book. You never want a book to actually end, even though you have to get to the end of that good book, or you don't want that movie or its trilogy or whatever to actually end, although the story will wrap up. And so the wrap up in some ways is always hard, right? Like when we're so eager to get to this goal, but it's always in some sense a grief.
Yeah.
The goal is always a grief, right? If you
Yeah.
take, whether it's the end of a story or taking an animal's life in as a hunter gatherer, there's always a grief there, right? That is lamentable.
Mm-hmm. Mm-hmm.
But until that moment, you're in the joy of this unfolding story, right? So that's a very different. I think, and I think that's a very different thing. I think people here, when they think about tracking, it's always so goal oriented.
Yeah.
Right. I'm going to find the subject of my tracking.
I'm going to be a successful hunter, and
right. Yeah. Or and that hunting could be, like I said, with a bow and arrow, or it could be with a camera. But it misses the fact that there is this, that you are actually. I mean, let's imagine we were, instead of a bow and arrow, we're hunting with a camera, right?
Yeah.
The idea with the camera is that you're going to at some point see the animal
mm-hmm.
and capture
mm-hmm.
the picture. But of course, when tracking, you're seeing the animal all the way along. You're
mm-hmm.
just seeing it in a different internal way. You're seeing it as it moves across the landscape. You're seeing it in its behavior. You're seeing all the choices it makes. And that seeing, of course, isn't just a mind's eye seeing. It's ideally you begin to embody the very feeling of that animal moving through the landscape. And thus it molds you, so you start to move through the landscape,
mm-hmm.
right, in the same way as that animal.
Mm-hmm.
As a matter of fact, so not only are you an observer of the story, you become a participant. It's more like acting. You become an actor on the stage of that story.
Yeah.
Right?
Yeah,
you are now in it, rather than in the background, in the audience, or as a detached observer, in a reading. You're now a participant, right? So
that's like the feeling of being a participant, right? Is, I mean, you feel a connection, a pull into it, and then being in it, it's, I mean, the feeling of being held, right?
Well, and I think, well, you're held in it for certain. That's good word. That's good wording, and maybe that's a way to think of a role, right? Like when we think about the roles, like we think about theater, for example. So rather than hunting this prey, you take on the role of becoming the prey which you're hunting.
Yeah.
So to be an effective hunter, then you have to actually become the hunted in the same moment. It's actually I never thought of it that way, but it's a recursive relationship. Until you become the prey you're hunting, you can't successfully hunt it.
Mm-hmm.
But you also have to be pushing the prey, thus pushing yourself in the role of the prey. In some ways, your own hunting is pushing yourself towards, that animal that you're seeking.
Mm-hmm.
That's a very different way to think about it.
Oh yeah.
Right.
Yeah.
But you have to. But it's relational. You have to be in connection. You have to be, and of course it goes even further, because I mean, if you look at the way that the Bushman hunter thinks about it, in some ways they never even enter in that until they actually feel an invitation from the animal itself. What they address to as ropes. That somehow reaches them out and touches them. And that's not a metaphor. They actually
feel it in the body.
Yeah. In dream time, they feel that touch and that pull, and that says, oh, and the direction, the timing. So it's like, they have to actually be given tickets to the theater and to the play, that they're then going to be almost like by a director, that they're now going to become a participant on the stage of. And then so you see these layers of unfolding. And then you can say, oh, well, this is why they're considered the best trackers in the world. They're not working on any singular dimension. Mm-hmm. But it's also fair to say, I mean, if we can now just cycle back to the pragmatics, I mean, they're good readers. I mean, they actually have the skills of
seeing the tracks,
read this track, and how old is it, and is it a male, and is it a female, and are they right leg dominant, are they left leg dominant, and are they injured, or are they not, or are they pregnant, and what are the weather conditions, and how all these things change based on dry tracks versus wet tracks, and on and on. So there is all of that shared knowledge base that's also transmitted through generations. But if you stopped there and thought this is what tracking is, you would hit your ceiling so quickly. I mean, you would be skilled to the degree that far more skilled than any of us as modern people. But you're not the mythical hunter that they've become in tale and legend, and the mythical tracker of the degree that they have. But and the other thing to realize that that's true is that it's not their tracking isn't just centered to the task of tracking prey. Like it's not just hunting is not just about hunting for meat.
No.
Right? So they track, so now to cycle back to the first question about health, like they also track for health, right? They track for friendships, they track for courtship. I mean, everything is the play of reading, the embodied and relational lines. But then you recognize it's all play and it's all role and it's all falling into and it's all being invited to and it's all, it's all of those things that we just talked about. So the notion of tracking, I love it because I think it's actually one of the broadest metaphors that we can use in all of our activities in life.
Yeah.
But not tracking as we would as a small T tracking metaphor, right? As the big T tracking of all of these layers of experience that they
all
have.
of the relationships that we have where we are.
Yeah,
right?
and all the ways that we engage that process, right? Which is not just technically or not just feeling, or not just spiritually, but in all of these different ways that they, not just socially, but that these are all simultaneous informants of the quality of our tracking. And I guess the other important part in that is it is like this exercise is never objective.
It's not about obtaining this concrete end of I've got it. Now here is health. Now I've obtained.
But even beyond the obtaining is the one part, right?
Yeah.
But even before there's the obtaining, you've got to see it as something to be obtained, right? Like to have.
What are you heading towards?
What are you heading towards, right? So that's that very objective othering and goal direction. But whether it's in tracking or in treating, what is the major source of feedback and response is actually one's own feeling, rather than the object of that's one seeking to obtain, right? So if we take it back for health, like this is actually a really primary metaphor. So let's take it out of let's take it closer to home, right? And let's take it to two types of medicine that live close to us, and the problem is they can live very close to us, and even those practicing the second type of medicine don't necessarily even recognize or often fall out of it thinking they're in it into the first kind of medicine. And so the first kind of medicine, I'll say, is the one we all know, so the traditional Western approach, and whether you want to call that allopathy or the orthodoxy or Western or whatever mode you want, but the visit to the doctor's office and the hospital mode, the prescriptive mode. And we all participate, and we know this really well. It's the medicine, the predominant medicine of our culture. And the reason it's the predominant medicine of our culture, it's also a reflection of the predominant way that we seek to understand and build knowledge, which is the scientific mode.
Yeah.
And their power, I don't want to minimize them, like because it's so easy to get in this sort of critical black or white. They're powerful modes, but they have powerful consequence that's sometimes that's often unintended. And so the science mode always says the scientist is an observer outside of the system it's observing. Mm-hmm. They have this, they claim this sort of impartiality, that their impunity, really, that their observations are free of effect on the system, and the system is free of effect on them. It's kind of an omnipotence of a sort, really.
As you put it, I'm like, whoa.
Yeah.
That's just so strange that when you talk about effect.
Yeah.
Right. That I can sort of be out here and what I think or what I say is going to make no difference, right? Because the things as they always are like that it sort of exists independent of us describing it or making sense of it.
Well, and it's actually an arrogance of claiming zero bias, right? That we can be human, that we're claiming to be human beings without bias.
Yeah.
Right? And that we're not biasing what we see and what we know to look for, and hence what we see, right? But this is the model we work on.
Yeah.
And of course, there are biases, so it gets us into trouble, right? Now, but when you think about how that sets up a mode of medicine, what that sets up is, I'm free of this. It actually sets up something that of course, ends up feeling like a bad relationship, but the doctor comes in thinking it's a-relational, right? So, you're the patient, and you are who I'm going to treat. You are the object, as in science, and we're going to do this objectively. Even your subjective reports, I'm going to try to be as objective as I can about them. And so then you will, as the object, be what is the object of feedback, right? And everything will be done to you, for you.
Yeah, I just get to sit back.
And
Come on, doctor.
And so there's the passivity, right? Because
Yeah.
so what that does then, so it creates an interventional mode. And I'm going to do interventions, whether it be surgery or therapy or pharmacology or whatever the course may be. And then we're going to perturb the system in such a way. And then we're going to look and see, I'm going to look and say, what is objectively is the response? Has it moved?
What's the difference?
What is the difference? So there is a feedback, but it's the feedback of, but the only participation with me as a physician, the feedback is what's going to be the next intervention on you as the patient object. And so it's very externalized. And back to the a-relational component, and patients feel this, I don't want to miss up my field by actually becoming enmeshed or embroiled in a relationship, right? Because that just makes it mucky to see. I want to be in this place of impartial observership. And we have a whole set of ethics that allows that to happen, right? Like, and I can understand how they get set up, right? Like, I don't want my shit to be the patient's shit. The patient is here. We're here for the patient, in service to the patient. This is about the patient's
Don't
experience.
take advantage of them in a time
any
of
kind of
vulnerability.
right? And these are actually, I think we can all agree, important parts of an ethical structure.
Yeah.
The ethics are right, but the question is the a-relational mode the way to accomplish that, or does it get mucky? So now the opposite mode that goes back to the tracking type of health scenario that we had talked about earlier says, can we have a mode of health where you as the patient are not the object of my obtaining or curing or whatever the endpoint goal is, but can we have a mode of health where my feeling, so now we're relational, enjoyment, my ability to entwine, to be in joy, my enjoyment, my reading, right, of this is centered to my feeling. And so, for example, I think an example that we have in the West is osteopathic medicine, traditional osteopathic medicine, traditionally, as the founder Andrew Still put it forward, at its best. I think a lot of osteopathy nowadays falls back into doing things to a person, right? It becomes modalities and fixing. I'm going to fix your shoulder, your knee, or whatever. But the original osteopathic moment wasn't like that, and there's still a number of osteopaths that practice from this position, which says, all right, what am I calibrating to? Well, as I put my hands on this patient, I'm not calibrating to them as an object. Like so I have to switch my perception.
Yeah.
I am calibrating to my feeling, to my becoming, to my rolling in this shared moment. And, and I am moving, and it's back to that. And then I am treating my own role as the patient I'm touching, right? It's, and in some sense we never actually find the patient, right? In some, it's like never catching the prey, but I'm going to keep tracking it, right?
Yeah.
And so now the point of reference and feedback is a sense of either dis-ease and disharmony within myself, at which point I'm calibrating and changing and moving into a state of resonance, a state of coherence, a state of harmony within myself. But in full relationship. So
Yeah.
this, with the person, the patient that I'm touching.
Yeah.
But not as an object, but as an intersubject that I am then calibrating to my own feeling within. That's a very different kind of medicine.
I mean, I have the image because I have the feeling of in my body of things like contact dance, improv contact dance, where there's not necessarily there's not a prescribed choreography of what it should look
Right.
like, only that you need to you have to take care of your own body, right? You don't want to put your body in a position that's going to sort of hurt yourself, but also to respect, the other person's body. And then beyond that, it's simply that space of player exploration, about how to stay in contact, because each moment there's just so much movement, and it's always this a question that's lived in the body about what choice do I have about how to relate to this moment, right? And because it's in the body, I mean, it's organized very differently than, should I do this kind of one move that I learned in this dance class that's going to do this kind of, no, I mean, it unfolds very differently from that.
It's a perfect example. And I think in some ways contact improv, and they call it dance, but it's almost better to drop the dance. So just contact improv, because you're contacting the other, and it's an improvised flow of movement. And it's a great example. So what's important is we set up with mutual respect, and that's really important too when we think about the hunter-gatherer society. Despite the fact that the prey is going to be killed and slaughtered for meat.
Yeah.
The journey is entirely one of respect, and then one of gratitude for the sacrifice and what they feel is an offering, right? Because it's felt as that this animal has offered itself up. So so that's important, because that's foundational, right? That somehow we have to come into contact respectfully. And I don't even know how I would articulate what that means. It's like, you know it when you feel it. You know it. Like, respect is something that we all know when it's there, and we all know when it's not there. I don't think trying to define it beyond that is, but it's there, right? And I think that is foundation. And then when you think about your contact improv experience, like you said, there's, what are you calibrating to? And of course, the amazing thing is, if for the observers outside of the partnership of the contact improv, if it's the 2 or the 3 or the 4 that are dancing together, very often you'll say, well, it looks like one organism, right? It looks like one being moving and flowing, right? So there is this sort of mergent from the observers looking out to in. There is a merging that very much looks like a loss of those singular identities. They've come together in a sort of amorphous way. But then when you think about your own experience as a contact improviser, and my own as well in that movement art, what you're calibrating constantly to is your own feeling, your sensations, your feeling. And if you get into the head, then you lose the flow. So to stay in the flow that is creative and non-purposeful and moving, what are you reading? Well, you are reading the tracks of, in some sense, you're reading the tracks of this shared, of this other's body and your body's response and their body's response to you. But you read that by further surrendering into the feeling of that experience, right? And then you're moving, right? Then you're moving across this dance landscape.
So surrender.
So that is an important term, right? Like, there is maybe that's a good one to look at. Like, what is it? I mean, what do you think we're surrendering to? Surrender is so important, but I think it's used trivially too often. So but it's central. So what is that? What is that? Like, because I don't think it's a nothing. Because I think so often surrendering is kind of like I think that we make it analogous to giving up often, and sometimes some part does give up or has to give up. I get that, but I think it's so much more than that. I think it's richer. I don't.
Because there's this like trust thing, right? Because it's, again, I remember these silly group building movement exercises where you have everybody kind of hold out their arms in a row, and then somebody kind of falls back.
Yeah.
Before you do that, it's based off of, do I trust that these people are going to catch me?
Yeah.
So there's that trust of, I mean, I'm not going to do it if I feel like I'm going to get killed.
Yeah.
In it, right? That there's something there that's going to meet me or hold me.
Yeah.
So I think there's that part as well. I don't know. Maybe trust isn't the right word.
Let's stay with it. So let's go back to health with trust.
Yeah.
So back to the two models. So the orthodox model is a disease model. Because when I objectify you, I'm not only objectifying you, I'm objectifying what's wrong with you.
Yeah.
Right? So I'm into the parts. Is it your heart? Is it your lungs? Is it your belly? Like, is it your immune system? Like, what's wrong with you? Right?
There's the question. What's wrong with you?
With you. What's wrong with you? And then when we find what's wrong, we're going to fix it. Because wrong means we have to make it right.
Yeah.
Right? So there's all these linguistic implications are important because they're the epistemology that sets up how the interaction comes forward, right? Mm-hmm. So if that was the system I had available to me as a patient or as a doctor, I wouldn't trust disease. So patients don't trust their diseases as wisdom or as their symptoms as communications. Like, would you trust disease?
Oh man!
Like, do you trust, words like cancer or myocardial infarction or diabetes?
Chronic pain.
Chronic pain, yeah. Yeah. So we both adjust here on it, in our chronic. I wouldn't address any of those namings. Mm-hmm. And once they're named, they're kind of entities. They're sort of, they're characters on the field now, right? But they're trickster-ish, and I would never trust them, right? And we're told not to trust them. Right? We're told not to trust your symptoms. Get rid of let's minimize your symptoms. Take this so you don't have to have that nausea or that pain, right? We're told they're not trustworthy. They're not, and we're told, and we're not even told their communications. We're told a communication of a specific sort. They're lying to you, or they're inconveniencing you or something.
They're broken.
They're broken. So with that model, I wouldn't trust it. Mm-hmm. Right? But back to the other model, right, which is, what are we surrendering to? Well, we're surrendering to something back to the enjoyment. We're surrendering ultimately to the enjoyment of participating in the story, mm-hmm. individually and shared, mm-hmm. right? We're so the tracking again, if we're surrendering to the story and becoming part of that and entering into that story. So when you think about that, then and same with contact improv or even those exercises, it's like we're surrendering into a place of connection, right? So if you said to me, oh, you can trust the health as it presents as these truthful feelings within. Mm-hmm. And I know the things about feelings, even hard feelings, is they're true. They're always true. You can't tell me that what I'm feeling, not what I'm thinking about my feelings. That could get us into all sorts of non-trustful places. Uh-huh. But the sensations themselves, the sensual, the sensational world, and even more importantly, once we let that embody happening, what's sensational is still objective, right? I, as a scientist, will measure your sensations. I think it was, what was it called? Was it psychophysics? There was an actual name for it. What are your thresholds for sight? Like how many photons or lux of light before you can see difference? If I poke, like what is the thresholds of touch? And so that's sensation. But sensuality is what we experience. Mm-hmm. Our external and internal sensational sensations that are open to us. And so that is I think where the trust comes in, because that's where health and then health isn't necessarily easy. Tracking an animal is not necessarily pleasant. It could be the heat of the day, the thirst, the uncertainty. There's getting lost. There's a lot of things. It's not a given. Mm-hmm. Nor is even the success of the hunt, or even that you'll survive the hunt. You think about the Bushmen in the heat of the Kalahari. I mean, they were on the edge of life at many, many moments, right?
Yeah. Some of them didn't come back, right?
Some of them don't come back, And sometimes the animals hunt them. I mean, there's lots of stories of gored by an elephant and eaten by a lion. Like, I mean, it's a classic Bushman bedtime tale. Once our people were eaten by lions. That's a really potent bedtime story to learn how to be in relationship with the land such that you don't get eaten by lions, right? So
I mean, the term that I sometimes the felt sense, right? It's not the thinking about what's going on, and then saying, what is this? What might this be trying to get my attention about? Is there something for me to learn here, or pay attention to, or do differently that I'm not doing right now?
Yeah.
And that can be uncomfortable.
Let's look at that wording. It just strikes me as problematic.
Great.
Something to do, something to do differently that I'm not doing.
Yeah.
And that strikes me as a regular doctor's visit. Oh, okay, that didn't work. What are we not doing here that we could be doing to make you better?
Yeah.
Right? And even I know, as I struggle with back pain, and I struggle with neck and back pain, I'm often like, what could I do differently? I don't know if the Bushmen, in the midst of their shared tracking, are ever asking the question, what should I do different? Now, let's go back to contact improv. Would you ever ask the question in contact improv, what should I do differently here? I think I would just fuck it up.
I mean, it's like it comes in and out. It's not always on. It's kind of, I know when I'm out because I'm in the head with the questions, and then it's like stay in contact, right? That's
right.
Stay in keep staying with what's going on and keep moving, and then it'll kind of, because it feels like it's safe to kind of retreat back and be like, so what do I do with this? And sometimes that comes from feeling like feeling stuck, like something's being offered and I can't move there with that there's a stiffness, there's a hardening, there's a tension, and it's kind of like trying to figure out, like, okay, in that stuck moment, that's when you kind of when I retreat out and I'm like, well, what the hell do I do now, right? Yeah. And it feels like it's like a space to figure something out, and then coming back into contact.
Well, that's perfect. So let's not make that a problem. So let's make what we're seeing is two modes that we can be in, and that we can shift from one mode to the other. We can go into and come out of, and that's a nice, a surrendering in, or returning and consolidating out. And I think that's important. I mean, in some ways, that's analogous to the Bushman creation story of a first creation of ever, that our teacher or mentor Bradford Keeney brings forward, of an ever, a place of flux and form and change, and then this place of naming, solidity, time, illness, and that is the human experience, right? And so I you can't forever live in the surrendered, in some sort of sense. You can't ever live in the amphoras. At some point, we come back out. We come back to ourselves. And so I think this oscillate now. So now we're talking about really an integrative medicine, right?
Yeah.
So rather than, honestly, I don't want just a Bushman medicine, just as I don't want the medicine that I'm very proud to practice. If I'm in a car accident, if I have dying of a pneumonia, a laceration I need sewn up, or even a chronic medicine illness to kick my butt, to say, I guess I better make some big changes in my life. You know what I mean? Even when there's not an answer of how to treat it, okay, well, it kind of names it. I can see it and play with that now. So just as I don't want entirely a Western, I don't want to give up a Western, for all I can criticize it, I don't want to give it up. And same with the Bushman medicine, like, I'm in that flux and flow, or the osteopathic medicine. I love it. It's all of these things. But at times I do have to come back into the responsibilities and demands of my life and my living, and so I think this notion of into and out of the dance, into and out of the hunt, now the whole thing is, how though do we put it all in service of health? So if I take a disease model, ultimately how's that integrated back into how does this let me step back into health and not just battle the disease, right? So we do have to really find, again, the dance of integration of in and out of different modes. But I don't think we have these different modes by accident. And that's also an important one, because I think it'd be really easy to say, oh, all of this is because of epistemological error. And I think that going forward, we don't get that privilege to be able to just discount our whole way of being, right? We have to go and say, actually, and this is that notion of multi-perspective or multi-perspectival, that rather than having an epistemology, more like nested dolls, can we have multiple epistemological perspectives that are in the right relationship to each other, such that they're in service to health?
Because then the problem you get, and I feel it sometimes, I see it out there, is this. Stephen Jenkinson talks about the seeing people in their dying days having a tremendous amount of terror and shame about their culture, about the way that they've been thinking, and that us as humans, we're a scourge and we're a disease, right? That what we've done is I mean, we sort of take that view of making it's almost like seeing the disease as disease, right? That way of thinking sort of gets inscribed upon itself, right? Which is a trap. And so you're sort of saying that it's really about relationship, that it exists within other ways of thinking, of being, of relating.
Yeah, I think that level of misanthropy, and you see it everywhere right now, right? Human beings as a cancer, as a virus.
Yeah.
I think that misanthropy itself is symptomatic of the position we find ourselves in modernity.
Can you say that word again? The way that you just said that.
Well, luckily it's recorded, so I can't. I don't.
Modernity.
Modernity. It's my country roots. Back to modernity. Ruth, crick. Modernity. Yeah, pitchfork in hand. You know? Yeah. Anyway, so we have this misanthropy, right, and these terms, and I think that's actually symptomatic of the state of unwellness and disconnection that we find ourselves in. And so I think we have to be very careful about that. And at the same time, so there's a tension, right? Which is, I think we have to reject that misanthropy. I absolutely think we do. But at the same time, we have to be in a position of humility to say we are a species like no other, like we are a species that is equal in its right of existence as any other species. And we're in, is it the sixth great extinction? Is that, I think we're in now, is it? Where we're having species loss like every 20 minutes on the planet. And there's nothing that says we can't pop out of the creative fabric of life on this planet, just like 99.9% of life that has preceded us. Right? So we don't have some special get out of jail free card here. At least I don't think we should assume that. And nor should we assume that who we are in our present form is going to continue over the course of evolutionary life. We are going to become, just as our deep ancestors were very different form than we were. In our unbroken lineage. I can only assume our form will continue to change and evolve, but there's nothing that says that this experiment called humanity is a successful one. We're in it. We don't know if it's successful until we're not human and we're something else, and we look back and say, and of course we're only here because our ancestors were successful in their experiment. Yeah. But there's no guarantee that we're successful in ours. So we have this interesting tension that says, I think we have to reject this misanthropy that says we are bad and viral and cancerous. And not mistake our essence and being for our behaviors. I mean, it's one thing to say our behaviors is cancerous, sure. Yeah. Our behavior is viral. But even the use of viral is an interesting pejorative, because when you think about the role of viruses, they're an incredibly important role in health in the ecosystem. the number and variation of viruses is near astronomical. 50% of the human genome sometimes is estimated as being viral in origin, right? So, so even the way we use this word viral in a pejorative term versus, well, actually, viral is part of the mechanism of life itself. Are we just out of balance with, again, it's an issue of coming back into balance. So I think that I'm not sure where we got to and how I got to this point in our conversation, but I do respect, I do reject the misanthropy because we don't know what's becoming. And also, one last, jump in, because there's one other metaphor that can help with it.
Because we've just kind of opened up now where we've come from, where life has sort of come from in this, we think of it as maybe an arrow of time of just in one metaphor. And then where is life going, right? That thinking ahead now that humans are just, sort of one little sort of piece in this, and that all along the way has been life unfolding, right? And it's meant that some things, they continue on, and some things don't for a period of time. And so there's this movement of life, right?
Well, and again, I just want to put a little more tension, which is we are one very little piece in this evolutionary tapestry, and the human experience and a notion of consciousness, not just of self-awareness, but of self-awareness.
Yeah.
As far as we know, we are unique in that, at least as far as we know.
And it's the gift and the curse.
It is a gift and a curse, and it is our experience.
Yeah.
So we're never going to get another experience. So that's why you need the tension, so that you don't become a self-absorbed species.
Yeah.
Right? Like that there's something to pull us out of our collective self-absorption. However, we never get to have an experience other than it's a human experience. But if you go back to the Bushman tracking, if we cycle this back to where we started, part of the wonderment of the human experience is that we can fall into the role and resonance of participating in the relationship with other living forms. So if the Bushman is tracking the eland, we have the unique human ability in feeling to become an eland. Now, is that how an eland actually is? Well, I don't know. I'm not an eland. But I know it lets me be an eland human or a human eland, which is different than just being a human separated from an eland. And we have that, and I think maybe that is one of the things that is our way into this broader health and sense of well-being in the world. So, but one last metaphor before we just go on, because I think that about the misanthropy piece, right?
Yeah.
And the virus and the cancer. So Daniel Schmachtenberger, a really great existential threat theorist in the world, put forth a great analogy, and he said, listen, I'll paraphrase it, but imagine an alien anthropologist came to study life on, an alien biologist came to study life on, xenobiologist came to study life on Earth, and had never seen a caterpillar before, right? And so they see this little larva, this cute little larva, these little larvae born into the world, and next thing they know, they start to eat leaves, and they're consuming little nibbles, little bites, and they get a bit bigger, and more nibbles and bites, and they get a bit bigger. And next thing, these caterpillars start to grow, and they eat, and they consume, and all of a sudden, it's like they're eating literally the leaves off, stripping them off the stems and branches and trees. And this, from this alien xenobiologist perspective, this is a feed-forward system that is unsustainable and is going to crash, and these larvae are going to eat themselves into their own death and extinction. And it's so obvious, and it must be even obvious to the larvae in their hunger and their consumptive needs themselves, because the leaves are becoming harder to find and are of less quality as they get bigger and bigger, and this is a train wreck. And then all of a sudden, something shifts so profoundly that no one could expect, and a chrysalis or cocoon is woven. And literally, there's a deconstruction back to the state of just protoplasmic goop where they literally become back to like a level of protonation and like a breakdown that is I mean, it's alive, but in a slime mold kind of way. Like it wasn't this structured being, you know. So there's this huge.
It's like, how is it now organized?
And a releasing of the organization.
Yeah.
Right. So
yeah.
there's this intermittent moment where the organization, the fetters and bonds of those boundary conditions are released, and then there's this reorganization, and then this profound we call it a metamorphosis and emergence out of the cocoon of a moth or a butterfly. Profoundly different creature, different beauty, different aesthetic, and that butterfly, of course, is not consumptive in the way that it was in a larval state. It moves in flows in balance with the rest of its environment. And Daniel Schmachtenberger said, you know, this could be that we, you know, all of our 200,000 years of Homo sapien and million years of Homo in some form is really just the larval stage.
Mm-hmm.
You know, and you could think that we go from the very small, bigger, you know. And one other analogy he gives in that, it's even just the human fetus, that it has this massive growth in this 40-week window. And but it has a very small window at which it has to go through this huge phase state transition called birth into the exterior world.
Yeah.
And there's about, you know, you can have a premature birth, obviously, but and the difficulties of that. But really, when we're looking at it, you're looking at a 6-week window, plus or minus 3, where this has to occur. And if it doesn't, it's catastrophic, right? It's a stillbirth.
Yeah.
So we see this in biological life, and I think that this is a great metaphor to help us to not become misanthropic and hopeless and resigned to an inevitable end, right? This is the midwifery moment of our species. Now, again, the humility, stillbirth is not. Not having a stillbirth is not assured, right?
So, I mean, I'll need to have a pause here to stand up and move around.
Yeah.
The phrase that comes to mind, and this is from Brad Keeney, spiritual cooking, the transformation, right, of who we think we are, right? And the metaphor of forging metal or blacksmithing, right? That taking something that seems so sort of cold and hard and rigid and heating it up, right? So that it can change, right? Which is again back to this movement between fixed forms, right? Can name it, can know about it, can do something about it too. Now the participation in something that's ever changing and moving, right? That what we take our human experience to be, who we are as a human society, that's not fixed, right? And we're granted with, as you sort of talked about, this kind of awareness or consciousness that that we can actually make a movement forward or do something, that we actually have to take a step in order to help initiate that change or that transformation, that cooking, right? It's not just we can't just kind of sit back and expect that the creative forces that be are going to help us out or going to help us see ourselves differently or get us out of the sort of trap that we're in, right?
But it's a very particular kind of step, right?
Yeah.
It's a step, not the right step, but a step of rightness.
Yeah.
And it's back to the contact improv, right? You're going to take a step, a move, a lunge, a fall, a roll in rightness, right? Yeah. And it's informed by, it's not, you're not making this, I'm going to do this step. It is formed by, and that's part of the humility too. Like we think that we're doing all of this, but we're always being formed by a greater context, right? Like we're always dancing and moving. It's shape. We're not free of boundary. Like it would be good to step back and say, in all of this, not just within the shared human societal mind, but within the broader place of time and place and the environment and the living world and the universe we're in, is it possible that we're also being danced and shaped in this? Right? Like, that it's not just our intention and our conscious will and our grand plans towards our grand goals, and back to the fix-it model, right? So where do we, and we'll finish maybe just to give that break to the back there, which is like, so we have to get out of the fix-it model, the cure-it model, the solve-it model, the problem, the catastrophe mediation model, and really come back in. I think this is again citing Brad's sense of a spiritual heating and a sacred emotion. Like, how do we, and this again, just we'll finish by cycling back to the beginning. How do we get into the story and move and make it primary that we actually right now we have all of these tracks of possibility into a greater societal and global wellness. They're all there.
Yeah.
How do we start saying, instead of saying, oh, that's what we're trying to get to and fix and mediate and keep and have our cake and eat it, how do we get out of that and say, in this moment, even in our poverty, even our distress, even in the midst of potential catastrophe, wow, there's a really interesting, amazing story for us to start to track and enjoin, such that we can enjoy this shared experience of moving through this landscape of our collective lives right now. And that is about, how you read that is not with your cognition per se, as it is with your emotional and spiritual intelligence, right? Like that lets you be participatory in the very book and story that we're reading together.
Mm-hmm.
Yeah.
It's like
Break?
take a break. Yeah.
You could do a standing up, kneeling down, lying down.
I'm going to stop this just to create this recording.
Yeah.